Hello, this is Dr. David Hornbrook at Keating Dental Arts, doing our weekly podcast called Dental Up. And if this is the first time you've listened to us, you'll see it's very casual, very open. We're going to have a lot of fun. You can go to www.keatingdentalarts.com/media. Look for our podcasts and our videos. Today, we're in for a real treat. I have the pleasure of introducing Dee Dee Reid to our audience. Welcome, Dee Dee.
Thank you. I'm happy to be here.
Oh, it's nice. And we're in Southern California. We're in beautiful Irvine,
Yes.
which you now live.
Yes, I do. I've been here 3 months. So
Yeah,
I'm a newbie.
Southern California's the best.
It is. It is. That's why I'm here.
Yeah, absolutely. And your back. Let's talk a little bit about your background. And
Okay.
I'm going to correct me and then add to it so
Okay.
that I know where you're coming from. You started off as a dental assistant
Yes.
a few years ago, and even though you're 23, you started when you're 12, so you've been doing 11 years. And you worked for a very successful practice outside of Dallas, doing a lot of cool things, which we're going to talk about. And then you decided to move to Southern California, and you're consulting, but you're also working as a treatment coordinator / office manager / patient treatment presenter or whatever it is.
Right.
For a young dentist here in Southern California is doing unbelievably well. So you have these two different areas of expertise, and I know now your role as a consultant. You're taking this on the road or certainly with other podcasts and lectures where you're trying to teach other dentists to do the things that you've done so successful in at least these two practices.
Absolutely.
So tell us what you're doing right now.
Well, as a consultant, I'm going into practices and talking about what's important, where do they want to take it to the next level. So it links in with your dental up. It's like where are we stepping up, and what's their vision. And then working on systems, how to implement new patient systems that work, how to be in a relationship-based practice so that you have a patient that's a long-term patient and that does bigger dentistry in the practice and looking for a more comprehensive approach. That's really the fun for me.
Oh, yeah.
Coaching the staff in verbal skills and communication on the phone, in consult, in the operatory. Because of my clinical background, I can talk clinical, and then we've got to get emotional with the patient so that they'll say yes. And so really talking through what's possible with a patient, showing them photographs, teach photography, teaching impressions, so that the clinical team can make hay while the sun shines,
Right.
It's like if the patient says yes, let's move, and so having those communication skills that work.
Yeah, and I think you touched on two really important things. One is the leadership and the communication that the doctor has with the team.
Yes.
That's something we're not taught in dental school at all.
Right.
We see a couple little vignettes, like if we molested some little patient, how do we deal with it? Or we are accused of that, how do we deal with the parent, or how do we deal with fees?
Right.
It's nothing about sitting down and really listening to the patient. And second is a team that is supportive, and I know that's a huge thing for you.
Yes.
You've heard me talk and speak about creating value in your practice. I'm a huge analogy person. I'm a huge using buzzwords and emotional buzzwords to get commitment and create value. Talk to us a little bit. Well, first, the demographics. So you go into these dental offices, big offices, small offices, young, old, big cities, small cities?
All of that. Yeah. So, in Houston and Dallas and Colorado and California. So it just depends. Even on the East Coast. So, for smaller practices, multi-doctor practices. Now that I'm in the practice where I'm at currently, is we're taking a baby practice and growing it. So,
Yeah, and I heard a few weeks ago we interviewed Lincoln, who is your employer in that practice, and he says that particular month that he was here was 72 new patients in the month.
Yes.
And here's a practice only been open for a year or a little over a year.
Yeah.
So and he talked a little bit about, for those who didn't listen to that, it was my interview with Lincoln Parker, and he talked a little bit about involving your community and being a player in your community. Talk a little bit about that. If you were to come to educate me and I said, I need more patients, what do I do? What would you suggest?
Well, there's a lot of things that he's doing in the community. He is involved with Chamber of Commerce. He is involved with any kind of derbies or fun runs, or there's like Lifetime Fitness. He's the guy at Lifetime Fitness, so they have little fairs, and so he's there and being in the community. He's also really active in his church, and isn't afraid to tell everyone he's a dentist, and and he's young and he's hungry and he's excited about dentistry. His personality is gentle and loving and connected with patients, and
you can sense that from him.
Yeah, they fall in love with him.
Yeah.
So so then they're referring and referring and referring. So that has been really fun to be a part of.
Yeah, and you touched on another important point is he's not afraid to tell people he's a dentist. I mean, do you encounter that? For one, is dentists rarely keep their cards. So someone says, "What do you do for a living?"
Like,
under their breath, it's like, "I'm a dentist."
Right.
Oh, really? I'm looking for a dentist.
Right.
Do you have one of your cards? No, I don't have a card, but look me up. Or check out my website, but they don't have good websites. So let's talk a little bit about that, because I'm sure that you get frustrated when you enter a practice that has all this potential, and the dentist is like this closed flower, and I mean, how do you deal with that? So you came into my practice. Imagine that, I'm that closed little introvert, which a lot of dentists are, right? I mean, you're not going to necessarily change that aspect. But if you came to my practice and I said, I need more patients, what should I do? I can't get out and be a cheerleader. What should I do? What recommendations?
Well, it's surround yourself with a team that has the skill set that you don't have. Have someone in your practice who has that outgoing, connected, loving, emotional personality, and have that be your right hand. Always hire the people that have the skills that you don't have.
Dental Up. Dental Hire Up.
That's right.
That could be another website for us. Yeah. Dental Hire Up, and we could get good employees. So, yeah, and I think that's so important. I have a good friend that's an unbelievable dentist, unbelievable, but a terrible communicator. And literally the patient would come in and they would say, can you give me a nicer smile? I'd like to talk to you about my smile. And he'd go, okay. And he would kind of avoid it, not because, he's an unbelievable clinician.
Right.
But he had to have someone in his practice that would say,
sing his praises.
Dr. Dent,
right.
Let's do this. Isn't this cool? Isn't this fun? And so, I've heard you talk to patients, and I've heard you role play. Yes. And, use words to get your patient to commit, obviously. Absolutely. And get them involved in treatment. So let's do a little bit of that right now. So I come in as a new visit, and maybe to the reception I said, "Oh yeah, does Dr. Hornbrook does he do something like the bonding thing or whatever?" And she says, "Oh yeah, they'll talk to you about it." So you hear "win" because I'm not going to put on my health history form because I'm a man, for God's sake.
Right,
I'm not going to put "help me look better."
Help me look cool. Right.
So what would be you sit down and you interview me as a new patient? Well, how are you going to bring that out of me?
Well, we talk about dental history, medical history. I also want to talk about what they're doing in their life. I want to know what are they doing their occupation. I want to know what they're doing for fun. Because I know if I get to know them better, we can treat them better. We take photographs in my initial consultation and we look at them together.
Now, do you take those photographs as a doctor?
I take the photographs and then the patient and I sit and talk about them before the doctor ever comes in, so that I have an idea of what's important to you. So I ask them. I pull up a big photograph, close-up smile photo initially, and ask them. I said, "What do you see?" "Oh my gosh, my teeth are yellow. Oh, I didn't know they looked that bad. Oh, there's all these things. Wow, my teeth are more crowded than I thought. I don't ever look at that." And typically men don't look at their teeth as much as women do because we've got high-powered mirrors for our makeup and lipstick and stuff. So, that's the difference in demographics. So, with men, it's like, so tell me how that could affect your life. Like, could that be different for you? Tell me about how important smiling is in your life. We talk about, their basic values: health, prevention, their smile. And when we talk about facial cosmetics, it's really interesting with men, how the lower third of the face actually dictates, or how the interior of the mouth dictates how the lower third of the face appears. Mm-hmm. The lip support, the jawline, wrinkles, the collapsing of the face. And men surprise me. They're like, "Whoa, yeah, that's important to me." However, they could say that their smile's not, which is which is interesting. So it's like, okay, so we want to maintain a strong jawline, so let's not have a collapsing face. In order to have that happen, then we get to do, a lot of cool dentistry.
Yeah, and another thing that you touched upon is, you're not really competing with other dentists. You're competing with other things that they can spend money on to either feel better about themselves or improve the quality of their life. And getting to know someone, right? I mean, you're in Orange County, for God's sakes, and there's 20 dentists on every corner. I'm in San Diego, the same thing. Is the only thing that's going to separate me in the patient's mind, right? From the guy or gal down the street is whether they like me as a person or they like my team as people, and I
that
care
they can
about
trust.
them. Absolutely, it's about trust and caring. So there's dentists that are listening, saying, "Oh man, I wish you worked for me," but you don't, and maybe they don't have you, and they say in their mind, "Okay, that's my role." Because most dentists are, they're interviewing the patient.
Sure.
The assistant sits them in a clinical environment. Well, let's first talk about that. So, because I changed my practice probably 15 years ago this way, where my first initial interview is not the dental chair. And
absolutely.
Because people are scared. I mean,
and
a lot of dental offices, the operatory is ugly. There's hoses coming here, and they haven't repainted
and it's
this.
scary.
And ugly colors, and so you would recommend that initial consultation is done
in a consultation room.
Or the doctor's office if it's clean.
Right.
That's why I had to go to the consultation. My office looks like it's like someone just robbed the place, right? And took out all the doors and threw it on the thing. So, so if it is the doctor, you would recommend they meet in a non-clinical environment.
Absolutely. And talk about what's important to the patient, because you want to base all your clinical diagnostics off of what they tell you is important to them. Otherwise, you're just telling them what they need, and nobody needs dentistry. All dentistry is elective. So if we are focusing on what the patient wants, then we can make better clinical decisions for the patient. If we know what the result that they want, then we can back it up and do all kind of different
Well, dentists typically aren't very good listeners. They want to tell the patient what they need, and this is the order that they're going to be done in, and we need to listen to our patients because they have different goals. And as a dentist that does a lot of aesthetics in my own practice, sometimes I have to meet that need. I'm going to fix their smile a little bit so they come back to be healthy perio.
Right.
And a lot of people would say, "Oh, you shouldn't do that. Make sure." And I want them healthy. Obviously, the teeth aren't going to be floating in the wind, but at the same time, if I don't meet their wants,
they'll go down the street and do veneers, and then they'll come to you to get their teeth cleaned, and you're like, "Whoa, why didn't we do this?"
And part of the process and the things that you teach obviously are educating the doctors maybe how to twist that a little bit. Where you come in, you want a nicer smile, but you've got perio, you've got problems. How can I turn it around so I get to do the perio first, and you be
well, we talk about their health prevention. It's like, okay, how are we going to do this in a way that makes the most sense so that you get the best result? You said that you wanted to be healthy. You work out every day. Your diet is clean. You're being a role model for your kids, and yet you've got a mouthful of perio, and you're kissing your kids. You're going to pass that on to your children. How important is that? And they tell me, my kids are number one. I've put myself off for so long and focused on my kids. I hear that from women all the time. And now it's my turn. It's like, it's your turn. This is where, in order for you to have that beautiful smile that you want, we got to get the gum tissue healthy so that when we build this beautiful smile, that it lasts a long time.
Yeah, absolutely. Good. Very, very, very good points. I think that's important. I think everyone can relate to that because they can relate it in their own mind. We have kids and we have girlfriends or boyfriends or husbands or wives. So let's run through some scenarios that'll certainly people will be able to relate to, listeners. So let's run through three scenarios. One is the young dentist that needs to build their practice. Okay, that's one. So what advice, and let me go through the three, and then I'm going to have you answer the questions. What can you do for me? I mean, what would you suggest as a young dentist? And you're going through that right now. How do I build this practice? I want to be successful, and I've got loans, and I've got these payments, and this whatever. Okay. Second is the dentist that has a successful practice monetary-wise, has a big patient pool, hates what they're doing, but realizes that they're 50 years old and they're going to have to practice for another 15 years. They can either be miserable, or maybe they want to change their focus on doing more elective, more cosmetics. And, I know you're big into the sleep dentistry and sleep apnea, as well as Invisalign and some of the other cool stuff. So throw a little bit of that if that's important. And lastly would be, and I think this is a big one, is the dentist that may be in a group practice that has different goals than other people in that group. Right, and so there's hurdles that there, and that could also apply to a young dentist in a DMSO or corporate dentistry, that thinking, how can I make changes? So I'm going to let you roll with that.
Okay.
Based on those three scenarios.
Okay, so starting with the young dentist, it's, how do I get patients through the door, and how do I maintain them? Like we talked about with Dr. Parker, he's very active in the community. He's getting connected. He's also done some things where he gets connected with massage therapists and chiropractors, and we see a ton of patients that we share. Physician relationships, as well as we do video on our website. I get comments on that every single day.
Oh, you do patient testimonials
we
too,
do,
right?
We do. We have a setup in our office where, we choose in the morning meeting 2 patients every day that we want to know, how it went for them. And we've got a list of questions that we ask them on video, and then we're able to edit it and post it online.
If a dentist wanted to get will you share that list of questions with people? I mean, do you do that as someone
that is something that I do when I come in and consult with doctors. So the next question was about
the dentist that's middle-aged, successful practice, isn't going to move, or they've got to work for another 15 years because they got their boat payment and their house payment and all this, but they hate what they're doing.
Well, that's about, let's get clear about what do they want. What would make them excited about getting out of bed in the morning? Like, what service mix, are you passionate about? Like, why did you get into dentistry in the first place? Let's reignite that fire, and let's choose some areas on where to expand. Like, you said, I do sleep apnea, and that is life altering for patients. Huge satisfaction at the end of the day, and it's easy. It's a lot of less doctor time, more auxiliary time, and it's profitable. So it's fun. You're not having to give shots. You're not, it's a fun interaction when they come in.
Yeah.
Another, different area that we've done is removables. Doing dentures. There's a huge market for that if you can communicate with patients, and to have a 50-plus-year-old patient change their whole appearance because they've had a collapsed bite, they've had old dentures, they've had, problems eating, and you can change the quality of life of that person, hugely rewarding. So, it's get involved in, if you don't have those skills, get involved in more CE so that you can deliver that in an effective way, so that it is exciting for the next 15 years. And that it's fun.
Yeah. So dentures, removable, sleep apnea,
Invisalign.
Okay.
That's a fun place to do with patients, because that's also another easy type of procedure.
Not enough blood for me. I like to see the blood.
You
so
do.
when I did Invisalign, I purposely made the trays a little tight and a little sharp, so when I went to seat them, the gums cut up a little bit.
Nice.
I just want to see that a little bit.
Yeah.
Yeah.
That's great.
Okay, the last one was the scenario where you've got a doctor that is motivated, passionate, excited, but they either have a partner or associate in their practice that says, you know what, I like what I'm doing, I'm status quo, I'm not going to make all these radical changes. That could also apply to a young dentist in corporate dentistry.
Well, it's looking for a coach to step up to some different leadership possibilities. And what do you want? It goes back to that. It's always, what do you want? Let's create it. Let's create a vision. Then we'll create a pathway in order to have that happen. So it may be stepping out on their own. It may be creating different partners. It may be creating training with their team to ignite the guy who's just the status quo guy. There's a lot of different opportunities there and a lot of different possibilities. My favorite conversation is a possibility conversation. And the things that come out of that are life-changing for both the doctor, his family or her family, and the team. Motivating the team to have more job ownership, having them have skills that they didn't come out of dental assisting school or what have you, or they didn't learn on the job, that now let's take it to the next level. Let's dental up again with not only your team but with your skills, so that you get to have the practice, you get to have the life that you want.
Yeah, and I think the team, the one thing I've seen you when you work with teams is about accountability and ownership, and not meaning that you own a piece of the practice, but
Right.
it's your practice. And I think, and there's a lot of practice management people, I won't name them, that they think the team's not important. Cut your overhead, pay your team less, and they're totally expendable, and you'll make more money, and you get more time off and retire early. It's like, oh, hold the fort.
Yeah, whoa.
Yeah, I mean, team members are so valuable.
Well, they're important because that's where you're spending the majority of your day, the majority of your time in your life. So let's have people around you that are excited about what they're doing, that we're all fired up when we're in our morning meeting every day,
Yeah.
Or you could do the same old thing and get the same old results.
Yeah, absolutely. So let's change the subject a little bit, because I want to talk a little bit about creating value and what your perception, because I know you've worked with some unbelievably successful dentists. You've made mediocrely successful dentists very successful and improved the quality of their life and the practice in the dentistry, make them feel better about themselves. So, everyone has opinions of this, but how would you envision an office that wants to move forward in a positive direction, and physically? What should that office look like? What should the team be wearing? What should the doctors be wearing? I mean, I have very strong opinions on this, but I'm not going to give you mine.
Yeah.
What should that visualize as you walk into a dental office? Who wants to be a state-of-the-art, cosmetic, restorative, whatever? What would you like to see that look like?
I want it to be relaxing. I want it to be comfortable. I don't want it to look like a dental office. I want it to look like a nice living room when they walk in. That they're greeted with someone coming out from behind the desk, greeting
You mean
them.
we shouldn't have that little glass window that opens 2 inches?
No.
We hand out a form and we sign? When they do that at a physician's office, I think, are they naked back there?
Like, what
I
are
mean,
they
why
doing
did they
back
close that so quickly? It's, come on, let me see. What are they doing? What are they doing? Okay, so get rid of that.
Yeah, get rid of that. Have the team come out to greet them as if they are a guest in your home.
Yeah.
It ought to have that homey feel. Offering them beverages, give them a tour of the practice. And that everything is clean and nice and neat. Like somebody's in charge of if the light bulb goes out, that somebody's on that, and that's their responsibility. Having accountability with the whole team doesn't have to be the doctor responsible for all of that. That we have a team meeting and let's walk the office.
Yeah.
Let's look at what, how could we have this be a more pleasant, a more exciting place to be. And if it's 1970s and 1980s decor, come on, get with the program.
Yeah.
If you want to have higher end dentistry, if you want to do more fun, comprehensive stuff, you got to look like you're up to date.
Yeah.
I have patients all the time that come to me and say,
absolutely.
"Yeah, I left there because I don't think he's done anything with that office in 25 years."
Mm-hmm. So how are they keeping up with everything else?
Right.
I mean, it could be, but
Right.
The other problem too, and this happens in my office, is we have a back door.
Yeah.
And I don't remember the last time I went through my reception room door or any of my employees. Yeah. So for them to come in that way and actually look at the magazines.
Be a patient.
Yeah, and look at light bulbs. We had to have a light bulb monitor because no one took responsibility for that. And we went out.
Well, we have
light bulbs out.
We have a bathroom monitor at my previous practice, and because we wanted to make sure there were enough, towels in there, and there were enough cups in there for mouthwash, and that there was a whole little vanity area that had products and stuff for patients to use, like a high-end hotel, like a spa.
Yeah.
So that they don't have to think about that, and it sets you apart. It creates value without you saying a word.
Yeah, and it's kind of interesting, the bathroom monitor. We just started doing this in my own office because people, it's not their bathroom. And so they come in and they drop, Kleenex on the
Right.
floor, and there's soap that's dripping down. Is one of the responsibility is whenever a patient comes out of the bathroom, whoever's close has to go back in that bathroom and just make sure that there's not a bunch of crap laying around.
Right.
We don't want that. So we don't have a whole lot of time left, but so what would you envision them wearing? So the person that comes out and greets, and then the dental assistant, quote unquote, and the doctor.
I typically like all black because it's clean, it's crisp, and we wear lab coats, white lab coats over it, so that there's a distinction in that. I feel like it gives a respect level to the team. Sometimes at the front desk, if they're in a suit, if they are professionally dressed, it sets a tone for what to expect.
How about scrubs?
I don't like scrubs. I think it's
I don't either.
it's messy. I think it's lazy. I think it's a lazy way to do it.
Yeah, I would agree with you on that.
I mean, maybe you change into a scrub top when you do surgery, or when you put on a gown on top of that or whatever. But back into dress clothes. I know that I convert more patients when we are dressed professionally than I ever. I mean, and I wore scrubs in my career. I've been doing this 27 years, and that's how I started. I thought that was cool back then. I wore tennis shoes, and it was all comfortable.
On your way to Starbucks, everyone thinks that you're a nurse or a doctor.
Nurse or whatever.
What hospital do you work at? Yeah.
But it also doesn't set a tone for excellence.
Yeah, I would agree with that. Good. So, Keating Dental Arts, one of our goal, and you're going to do some cool things with us,
Yes.
is to help doctors become more successful. And all the things that we've talked about, it could be whatever, right? They want to be a better doctor, they want to be happier, they want a better team, team members that want to be in better offices or better teams. So, what would you see? We're going to pull, as a clinical director of education here at Keating Dental Arts, I'm going to pull myself away from it, and as I want you to. If you went into a dental office and you ask the question, what are you getting from your dental laboratory that's helping you? Or if the doctor says, I think I might need a new dental laboratory, I don't feel like they're listening to me. I mean, what should we as a dental lab, them, I'm going to put Keating Dental Arts over here, what can they do to help this whole process that you're helping the doctors with?
I think they need to be in relationship, just like we are with our patients. The more communication that you have with your doctor, the better product you can deliver. It also will help take pressure off the day-to-day things that happen in the practice. You want us to be able to send a case out with confidence. They're going to do what they do because I sent them what they need. So, the relationship responsibility I feel from the doctor and the team is to request what you want in a way that they get it. And if you're not getting it, having more dialogue, not just throwing your hands up and saying, oh, next,
I need to try another lab.
Whoever comes along. But it's like, if you want a specific thing, let's work through it. Right. Working through that relationship will have you have a better result, just like you do with your patients.
Yeah, absolutely. Good. All right, we're gonna wrap up. This was fun.
It was
because
fun.
It wasn't clinical. It was very fun. You're very animated, which is awesome for me, and you're obviously very educated and very bright. If someone wanted to get a hold of you, to have you come in to visit them and help their team or help their practice, how would they do that?
They could either email me or call me directly.
And your email address is?
D2, D squared, since my name is Dee Dee.
Okay, D, just one word.
D2,
okay.
D2 coaching and consulting at gmail.com.
Now you just took that D2.
I know, it went crazy,
now I
right?
can't remember. Was it coaching and consulting or
D2 coaching and consulting at gmail.com.
Okay, awesome. Good. Did you have fun?
I had fun.
You want to wrap up with anything else?
I'm
you got a nice tan. I bet.
I know.
This time last year when you were in Dallas, you didn't have this tan.
I was glowing in the dark.
Yeah. Well, it's good to have you here. Again, visit us at keatingdentalarts.com/media to see some of the videos that Dee Dee has filmed with us, as well as some of the stuff that we've done in the past. So hopefully we'll get a chance to meet some of you and work with you personally in the near future. Thanks for listening.